I'm Robert DeMeff, a physician with Texas Orthopedic Associates in Dallas. I'm going to spend the next few minutes talking about mesenchymal stem cells, namely autologous mesenchymal stem cells. Autologous means taking tissue from your own body and using that as opposed to getting it from a different source. Now, when there's an injury to a body part, whether it's an arthritic joint or a tendon or ligament injury, there's this whole cascade of healing that occurs over the course of time, where the injured tissue releases some growth factors, it attracts some cells, there's tissue that starts to evolve and develop and gradually remodel over the course of time, meaning months and years from these injuries. And the idea behind using stem cells, or so-called stem cells, is to try to get these cells there faster to stimulate a better healing response. Now, we have basically four sources of so-called stem cells. The first are embryonic stem cells, which come from embryos, obviously. There's a lot of ethical concerns about that, but basically we don't do clinical work with embryonic stem cells. The second are adult-induced pluripotential cells, where we take them from the individual themselves and manipulate those and use those to try to treat a medical problem or medical condition. Those are very much research-oriented, and they're not clinically commonly used at this point in time. The third are fetal cells, namely amniotic fluid, amniotic tissue, or umbilical cord blood. We talk about that in another video. And then the fourth are basically adult stem cells, meaning you get your own cells. Now, there's lots of places that we can collect cells from an individual and use those to try to stimulate healing. The two places in the United States that we can do this are from the bone marrow or the fat. In other countries, other tissues can be used, such as peripheral blood, the periosteum, synovial lining, etc. But in the US and Canada, for that matter, the only source of adult cells that we have that we can utilize as so-called stem cells are from your bone marrow or from your fat. Now, with bone marrow, what's done is we take a needle, a relatively large needle, and put it into the bone marrow, usually in the posterior iliac crest, because that's the highest concentration of cells, and then through some special techniques we will withdraw that fluid, which also has growth factors, and then spin that down and concentrate that so that the individual then gets injected these immature hematopoietic cells from the bone marrow along with growth factors. One of the problems with BMAC, as it's called, is that after age 40 there's not a lot of cells in the bone marrow. And so therefore, what many people do in other countries and in the Caribbean is they will take those cells and grow those in culture, make more of them, and then inject those cells into the injured body part, usually arthritis, but other issues, other problems as well, to try to give the person more cells and more growth factors. The second place that we get cells is from the fat. And it's not the fat cells themselves that we're trying to collect or isolate, but rather something called pericytes. And what pericytes are cells attached to capillaries. And when there's an injury, these capillaries rupture, the pericytes get exposed to the injured area, and it's the pericytes that are the cells that stimulate this healing response. And these are viable for many months after an injury. And as they're doing that, some of them differentiate into the cells that of the tissue that's damaged, but oftentimes they're acting more as a signaling cell that there's injury, and it attracts other cells, stimulates increase in other growth factors that lead to a better healing response. Now, in terms of mechanism of action of stem cells, I've alluded to the fact that how these work are you have these immature cells that can propagate themselves, in other words, reproduce themselves, but that they turn into progenitor cells that form other cells. But the reality is this is a much more complicated situation than that. And when we have exposure to these immature cells, or so-called stem cells, there's a whole cascade of genetic expression of different cells that occur to upregulate protein production, block inflammation. There's a whole variety of things that can occur. And the reality is we only know a very small amount about what actually happens when these cells get activated, literally the tip of the iceberg. The current theory, however, on the use of pericytes, which are these cells that we collect from fat, are that when we inject these pericytes, they do stimulate the healing response, but also become so-called mesenchymal stem cells. Now that term was invented by Dr. Kaplan 30 years ago, and he's actually changed the term to medicinal signaling cells standing for MSC, with the idea that these are signaling cells. So these pericytes become mesenchymal stem cells that get activated, and it's these cells that we feel stimulate the healing response and convert into the cells of the tissue that was damaged, whether that's muscle, cartilage, ligament, tendon, or bone. Now, the theory right now is that the bone marrow cells are more driven to become cartilage or bone, and the pericytes, or the fat cells, are more likely to be more soft tissues. But it's not absolute by any means. How they work, we're not really sure, but there is definitely an interaction of these cells with the environment, and these cells trigger a healing response, as well as modulating inflammation, decreasing inflammation, and accelerating an immune response. If we look at studies using autologous mesenchymal stem cells, meaning bone marrow or fat, in the United States, most of them are in treating osteoarthritis, and for the most part these small trials do show that these help people with osteoarthritis. The outcomes are improvement for 6 months, a year, 2 years. We don't know how long these last. The animal studies show that it can help with repairing tissues like meniscus and tendon and ligament, but those are limited in humans in terms of the studies. The other important thing to understand about these is these really shouldn't be done necessarily in isolation, because there's a lot of other things that may need to be done to help make the environment healthier, whether that's injecting growth factors at some other point in time, hyaluronic acid, or other treatments that we do. So in summary, autologous mesenchymal stem cells we can get either from your bone marrow or from your fat, and these injections, with or without growth factor, will stimulate healing response of arthritic joints, tendons, and ligaments. In the United States, we have sources from fat and bone marrow. In other countries, there's other places you can get the tissues. There's no question that this does seem to be a good treatment. We don't know how effective it is just yet, but it seems to be relatively safe. However, it is expensive. We don't know, again, how many cells are ideal. We don't know if re-injections need to be done, or if they should be done regularly, or when they should be done. We don't know if there's other injection therapies that should be done along with this. Most of us think it probably makes sense to do that, depending on the cost and availability. And unfortunately, we don't have the studies that we absolutely want to be able to tell a person that here's how effective it is for any one individual. So more and more studies are being done, and I think in the next 10 years we'll have a lot better information in terms of being able to give people the best information about how effective this will be for their condition. Thank you. If you have any other questions, you can be referred to some of the websites listed at the end of this video.